I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule?
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, Okay.
But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that, something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?